Good afternoon, everyone. I'm happy to be here to provide today's updates on COVID-19, and let me begin with our latest numbers. I'm pleased to share that almost all our indicators continue to trend downward. After a difficult fifth wave that brought so much uncertainty over the past few months, this is very welcome news. Over the last 24 hours, we have identified 791 new cases of COVID-19 and completed about 2,800 tests. This puts our positivity rate for lab-confirmed cases at about 27%, which is nearly a 14% drop since last week. There are 11,189 active cases in the province, and that number has also been decreasing. In fact, there are 68% fewer active cases today compared to the beginning of February. Sadly, over the past 24 hours, 13 new deaths were reported to Alberta Health. I extend my deepest condolences and sympathies to the families and friends of those Albertans. Another declining trend is the number of schools that have had to shift to online learning to address operational challenges. Alberta Education has confirmed that as of today, there are no schools in temporary at-home learning. Looking to hospitalizations, 1 week ago, there were 1,500 Albertans in hospital with or due to COVID-19, including 121 in ICU. Today, there are a total of 1,373 in hospital, including 90 in ICU. This decrease is a positive sign that pressure is easing on our healthcare system and hopefully a beginning of relief for our hardworking healthcare workers. They're under strain, and I feel for them, and I am grateful to them. But even with the strain they've been under for the past 2 years, they continue to do a remarkable job for the patients that they serve. AHS is currently completing about 95% of normal surgical volume, and my department and I are supporting them to get back to 100% as soon as possible and then to go even higher. And it's not just surgery. Our dedicated healthcare staff are keeping the system working at high level in other areas as well. In cancer care, patients are getting access to treatment within about the same time that they did before the pandemic. Even in continuing care, where there's been a particular strain on the workforce, services are there. For patients waiting in hospital for a continuing care bed, the average wait time is actually shorter now than it was before the pandemic. Our continuing care staff and operators are working incredibly hard to maintain access, and your government is working hard to support them. The health system is still there for patients who need it, and it's a strong foundation to build on as we get past the Omicron wave and work to improve access and wait times, and reduce wait times. Not just restore the system to the level we had before the pandemic, but give Albertans better access to surgery, diagnostic tests, and other care right across our healthcare system. As we look towards our next stage in easing measures, I know that some Albertans continue to be concerned about protecting themselves from COVID-19. But the science is clear. The single most effective way to protect ourselves and each other is by getting vaccinated. And this includes ensuring Albertans continue to get their booster shots. In Alberta, while 86.8% of the adult population has received at least 2 doses of the vaccine, only 44.9% has received a 3rd dose. That means there are still hundreds of thousands of people who haven't yet received one. We need to close the gap to help keep hospitalizations low as we prepare to further ease measures. So if you haven't gotten your booster shot yet, I encourage you to do so today. One of my key priorities is to get our vaccination coverage higher, and that includes removing barriers to receiving vaccines, as well as answering questions and urging people to make the choice to get vaccinated if they haven't done so yet. Teams at Alberta Health and Alberta Health Services continue to look for ways to make getting vaccinated easier for Albertans of all ages. Currently, 47.2% of children and youth have received at least 1 dose, and only 24% have received 2 doses. We believe that by easing the burden on working parents and guardians of booking, arranging, and getting to vaccination appointments, we'll see an increase in the number of young Albertans between the ages of 5 and 11 years who are protected against COVID-19. That's why I'm pleased to announce that we're increasing the options at the 97 AHS clinics offering pediatric vaccine across the province. From March 2nd to 16th, AHS clinics across the province will offer walk-in options, including evenings and weekends, with some clinics beginning to offer walk-in doses starting this week. The clinics will operate from 3 p.m. to 8 p.m. Monday to Friday, and noon till 6 p.m. on Saturday and Sunday. After March 16, demand will be assessed to determine if the expanded services should be continued. That being said, appointments are encouraged and will still be honored at all AHS clinics. In addition, I am pleased to announce that there will be more pharmacies offering pediatric vaccines to create additional access points for Albertans to have their children vaccinated. 17 pharmacies in rural communities will be offering pediatric vaccines, and will add pharmacies in Edmonton, Calgary, Red Deer, Lethbridge, Grand Prairie, Medicine Hat, and Fort McMurray. Approximately 150 pharmacies will be asked to participate based on their experience in immunizing children, and they'll be ready to start as early as March the 2nd. Finally, I'm pleased to say that a number of physicians will also be helping to vaccinate the youngest eligible Albertans from March 2nd to the 16th. About 30 physicians have expressed interest in administering vaccines, and their office will begin to receive supply soon. And any other family physicians interested in participating will also be eligible to provide children's vaccines. I know that many Albertans continue to weigh the pros and cons of vaccinating their kids, and I hope that increased availability helps to make this decision easier. As we near the 2-year milestone of COVID arriving in Alberta, I want to recognize what an incredibly challenging couple of years it has been for everyone. The current Omicron wave is passing, and we and other jurisdictions are returning to a more normal life. But I urge Albertans to continue to follow the rules that are still in place. This is especially critical in continuing care settings where enhanced measures will remain in place even once we're into step 2. Please respect those rules and do your part to help keep those vulnerable residents safe while they receive the care that they need. We want to continue to support each other through this transition, and that means respecting each other's choices and accepting that people will transition at their own pace. So thank you, and I'm now happy to take questions.
Thanks, Minister. We've got a couple of reporters on the phone, so we'll go to the first caller, please.
The first caller is Carrie Tate from Globe and Mail. Please go ahead.
Hi, thanks for taking my call. Minister, I'm wondering if you have a goal for childhood vaccination rates in light of the push in March.
Yeah, we haven't set a specific target, but we would like to increase it and move closer and even achieve the average across the country. We do know that when initial surveys were done, roughly 1/3 of the parents in Alberta were interested in getting their kids vaccinated. We've surpassed that, but I do know that when we compare ourselves to other jurisdictions, we are one of the lowest in the country, and I'd like to actually reach the average for the country. And this is one step in that direction, is providing easier access for parents to get their kids vaccinated.
Thanks, Minister. Follow-up, Carrie?
Sure. Minister, why do you think parents in Alberta are more reluctant?
Yeah, really great question. We've seen that before, and even in terms of the initial surveys that were done, that there tend to be more reluctance. I think honestly, some parents are taking a wait and see attitude in terms of, we'll see, how the rollout goes. And I also understand that some parents who have seen their kids get COVID with the Omicron wave, which has been so prevalent throughout the province, at this point in time, maybe saying, okay, I'm going to hold back if they haven't got vaccinated. But again, I would, urge all parents that the best protection, even if someone has actually had COVID, is to get vaccinated, and urge them to do so. And hopefully the changes we announced here will make it easier and increase the vaccination rates.
Thank you.
Thanks, Minister. We'll go to the next question, please.
Next question is from Elise Schulte, CBC Calgary. Please go ahead.
Hi, Minister. It's actually a non-COVID question for you, sorry. But your expert advisory panel last year recommended a shift to more community-based care for elders and seniors. Your government has said it's working on a plan to address that. Can you tell me, do you expect to see significant changes this year on that file? And if so, what should we be watching for in tomorrow's budget?
Yeah, so a couple of things. As you know, we did a facility-based continuing care review that was done last year. Government is working on a response to that, and you're quite right. As part of that review, is looked at more community-based care, and also be able to expand our continuing care system. So when moving forward, we have legislation, continuing care legislation that we'll be introducing this session. And that's going to help us renew our legal and regulatory framework because right now we have different acts that apply to the continuing care setting, and it's across the field. It's very complex and it's difficult to manage. So we're bringing that all under one act, and then over the course of the next year, our focus will be is getting the regulations right. So we can actually move towards a policy environment that supports care at home, because that's what we heard loud and clear. In addition, we've talked about before our need to support the continuing care sector, and as well as there's going to be an increased demand, basically for more continuing care spaces. So I'm not going to jump the gun for tomorrow, but you will see a focus on us in terms of expanding continuing care spaces over the next year.
Good. Thanks, Minister. Elise, follow-up?
Thanks. Yeah, I appreciate that. As you know, and you mentioned, there's a capital investment that's been recommended, and that's included some new models like the small care facilities. At the same time, advocates have been working with your government to look at what additional programs in the community that seniors would need to stay at home longer. Do you expect most of the funding will be for experiments and research in that area, or are you actually getting ready to roll out some of these new programs and grants at a larger scale this year?
Yeah, so we'll have to wait for after the budget, but again, our focus is on getting the policy environment correct, and then looking at new model, like capital, and then also looking at new models to be able to provide services to Albertans, particularly those who would actually otherwise need continuing care spaces.
Thanks, Minister. So we had just 3 callers initially, so we'll take just one more, the last of the 3.
Next question is from Kevin Nimick, CTP Calgary. Please go ahead.
Hi, Minister. You announced new COVID deaths reported in the past 24 hours, but we still haven't heard about reported deaths from the previous 96 hours. So how many deaths did Alberta Health record between Friday and Monday?
Yeah, so those numbers will be updated. Actually, I think they're being updated on the site as we speak in terms of all the numbers for the last 4 days. So if you just go to the site, you can see them there, and they're being confirmed as we speak.
Thanks, Minister. Kevin, follow-up?
Yeah, I'm on the site and they're not here. I'll keep checking, but could you elaborate a bit more on what the technical issues are that your team's facing?
Yeah, so there is a detailed amount of assessment that the teams that double check. They were able to do it very quickly for today's update for 24 hours, but doing over a 4-day period, my understanding there's a significant amount of work to do that. My thought it was actually done, and they're updating it the site right now, but it should be done within the next few minutes, and then if not, we can actually get that to you through our press secretary, Steve.
Thank you.
Great. Thanks, Minister. Thanks to the callers. There were just 3 today, so that wraps it up for today. Thanks again, Minister.
Thank you, everyone, and have a great afternoon.